You're listening to the Doctor Is In podcast. This is the show where you get the best tips, tricks, and nutritional hacks to help you and your family get healthier. You'll also hear what works and what doesn't work so you don't have to waste your time and money. All right, let's get started.
Hello, I'm Dr. Martin Jr.
And I'm Dr. Martin Sr.
And this is the Doctors In podcast, and this is episode 143. Today we want to talk about a few studies that have come out over the last few weeks that have caught our attention. We're going to kind of go all over the place today. We did this back on episode 141, and we got a lot of feedback. People kind of liked the different studies we talked about. So we figured we'd do the same thing again today. And again, these are studies that offer some very practical feedback that you can use right now in your life to help you out in different areas. So let's talk about a couple of them first. And here's one that I found was interesting. We could talk about this a little bit. This study found that markers of insulin resistance. So here's a few of them, for example. High triglycerides is one, low HDL, and remind me to talk about that for 1 second after. I just want to read the rest of the study here. So high triglycerides, low HDL, and obesity or other markers like that are present 30 years before the diagnosis of chronic kidney disease, which is incredible. So imagine having a 30-year advance notice on a disease like chronic kidney disease, which is a major problem today, and it's only getting worse because of diabetes and type 2 diabetes. It's getting worse and worse. Hospitals across North America are building dialysis units. They're building all these kidney treatment centers because it is becoming a bigger problem. And for a lot of people with diabetes, that's how it ends.
Yeah.
Kidney failure,
Yeah.
right? It doesn't end well. So imagine having a 30-year warning that your kidneys are going to end poorly. And that's what markers of insulin resistance do. So if you have high triglycerides, you have low HDL, or you're obese, there are some other markers there as well. But those are some of the bigger ones that people have if they have insulin resistance. You get 30 years advance notice. So it's a lot of time to change things.
Yeah, you can reverse it.
You can reverse it. And studies have shown when it comes to type 2 diabetes, an actual full reversal of diabetes in 12 weeks when they did a low carbohydrate, essentially a ketogenic diet for 12 weeks, which for some people, well, for a lot of people, that's not easy to do, right? 12 weeks of going keto is very difficult, especially in today's culture, because of all the food available that are just tasty, high reward foods, right? Where we just crave them. So it's not easy to do. But 12 weeks of low carb reverses type 2 diabetes for a large percentage of people that were in those studies, right? So, I mean, it's like 12 weeks, fix your type 2 diabetes.
Yeah.
However, so here's, like I said, here's a study showing that you can get a 30-year advance notice on your kidneys failing.
And let me say this, okay, just from practical experience and clinical experience, that any kidney disorder, almost anything that you can think of, kidney stones, high protein in the urine, recurring kidney infections, even a lot of times urinary tract infections. But when it comes to that area and kidney stress, the number one cause is insulin, high circulating insulin. Folks, if you're listening, if you have any issue, you know friends that have issues with kidneys, and you're wondering why, and you might think genetics or whatever, they might have some genetic predisposition because of what their genetics are, but I'm telling you, it's insulin. And when I lower people's insulin, which is always our goal with our eating program at the Martin Clinic, it's always the goal. For other people, it may be the goal is weight loss, and their goal is, I want to be more energy. But my goal is always, because I know all of the above gets better, and that is you got to lower insulin. Because high circulating insulin is detrimental big time to the kidneys. But isn't it amazing how resilient your kidneys are? Is that if you have high triglycerides, you're eating. Triglycerides is simple. It's you're eating too many carbohydrates. It's as simple as that. You got elevated insulin, it elevates your triglycerides.
Isn't it funny how salt was the patsy when it came to kidney issues, right? I mean, they just blame salt for everything.
Yeah.
Salt was blamed for high blood pressure. Salt was blamed for kidney issues and lower salt diet, and you're going to be okay, and it hasn't helped anybody. Now they're starting to realize that, no, actually insulin controls a lot of the water volume. And, it's funny how things change, right? Now research is showing that you actually need salt, and you actually need more than people thought they did. And when you lowered salt too much, people didn't do well at all, right? It actually increased the risk for a lot of issues.
Yeah, and a lot of medications really plays in kidneys, right? It really messes them up because of this, exactly what we talked about, this salt, this dysfunction, right? They're often diuretics and other things that are meant to, temporarily lower your blood pressure or whatever. They have the opposite effect on your kidneys because they start getting your kidneys to play games, right?
And the funny thing with salt is that a lot of the salty foods that they would say were bad for you, they would blame it on the salt without blaming it on the vegetable oils or the combination, which is the worst combination of fat and carbs, right? There's these fatty, carby foods that had salt in them, a.k.a. like potato chips and stuff like that, and they blamed all the kidney and all the high blood pressure on the high salt. It's like when they used to blame the butter for what the bread did, they're blaming salt for what the carbs did as well, right? A lot of times, because a lot of these foods that you put a lot of salt in generally are high carb, high fatty, bad combination, vegetable type of fats, right? But as I was saying earlier, and this is something that I just want to stress because I found this very interesting, because a lot of people worry about cholesterol because, again, there's so much confusion when it comes to cholesterol out there. But something interesting has come out. It's a massive database. It's called the Framingham Offspring Database. And what they found is this, and this is fascinating. If your triglycerides are below 100 and your HDL is above 40, it really does not matter what your LDL cholesterol is in regards to cardiovascular risk. So if you have a good high HDL and your triglycerides are low,
right,
then the cholesterol number doesn't impact you at all in terms of cardiovascular risk. They're blaming cholesterol when the problem is the combination, really, which is high triglycerides, which is terrible. And we've talked about triglycerides a few episodes back, so you can go back and listen to that as well. But anyway, so that's one study that we found this past little bit that we found interesting. Here's another study. This one specifically, let's talk about two quick ones on fish oil, because, again, we're big fans of fish oil. One study found that 2.5 grams a day can lower inflammation in older adults, right? One of the things that ages us, because studies have shown this, right? Chronic inflammation accelerates aging. We age faster when we're inflamed. So if you want to keep your biological age low, we talk about the difference between chronological age and biological age. Somebody could be 50, but their cells, their telomeres, everything is like 45, right? Their biological age is nice and low. And then it could be the reverse. Somebody could be 40, but they're so inflamed and everything that their biological age is in their 60s, right? So if you want to lower inflammation, which is very practical for pain, first of all, very practical for joints, very practical for your skin, for your hair. But if you want to lower inflammation and you're older, this study found 2.5 grams a day is effective at that. So that's the first study. The second study goes along the lines of another big issue as we age is sarcopenia, right? As we age, muscle wasting is a massive problem. It will disable you, right? It is probably the number one cause of disability in older adults. They don't have enough muscle mass. Their quads, their hamstrings, triceps, they can't get out of a chair. They fall a lot because of the muscles. A lot of people blame it on their balance, but a big part of your balance, your proprioception, is muscle mass, right? You want better balance, build muscle. You have a lack of muscle, you're going to have balance issues because the muscles can't correct. I mean, think of what has to happen for your brain to know where your limbs are in space without looking, right? It's like you could reach for a cup on a table and not even look at the cup and pick it up, and your brain knows where your hand is. It knows what's going on. It has that ability for you to reach for that cup and not even look at it, but you know exactly where it is. Well, every time you step, it's not like you're looking at your feet, right? But your brain it's called proprioception, has the ability, and when your foot hits the ground, your body corrects very quickly for any kind of uneven, or if anything happens where you miss a step, but your body corrects for that all day. When you have poor balance, a lot of times is because the muscle mass in the kinematic chain, all the way from the ankle all the way up, are just wasting. So that's a big problem in people who fall.
Yeah, and fall and break a hip, and then now they're checking out, right? And a lot of people, as they get older, a fracture, the fall is the beginning of the end, right? For them.
Yeah, it doesn't end well after that. So this study found that 5 grams of fish oil can protect against what they call disuse atrophy. And it does so by increasing muscle protein synthesis. Basically, it can help prevent muscle wasting. And this study showed around 5 grams a day, which, to be honest with you, I like the 5 grams more than the 2.5 grams, right? I like that number more for a lot of people. They tend to do a lot better on 5 grams. Now, for some people, when they take a fish oil, and we like DHA, we have one that we really like, we use in our clinic. But for some people, they got to take a digestive enzyme when they take fish oil. Because it's an oil, you tend to do better when you take it with a meal. And some people, to digest it, they can spread their dosage out if you have to. But for some people, just take it with a digestive enzyme. And we hear this a lot of times where if somebody has a little bit of an issue with digestive indigestion or bloating or whatever, any of the symptoms of low enzymes, they do well when they take it with a digestive enzyme. So there are ways that you can get that in. But regardless, 5 grams can help protect against disuse atrophy, which if you're in a hospital, this is something that's interesting that, really surgeons and a lot of the primary care physicians in a hospital should be looking at, because, somebody comes in for a surgery and they're a little older and they're not going to be moving around. You lose muscle fast. It's amazing how fast you can lose muscle volume and you can lose muscle. So if somebody is coming off a surgery or something, it's something that maybe the doctors want to start looking at doing more, which is giving them enough fish oil to kind of fight against that disuse atrophy that comes with that.
Yeah.
And think about when you injure yourself coming off an injury, you break a leg, you're not using it for a long time. Taking 5 grams of fish oil not only helps with disuse atrophy, can also keep the inflammation down low. So it's kind of a double thing. So, which is why we really like high dosage of fish oil when somebody's injured, for multiple reasons, inflammation, all that kind of stuff, right? Anyways, we're big fans of fish oil. And here are 2 more studies that come out recently that kind of just give you other reasons. Again, we can go through the research on the effect it has on your brain for dementia, Alzheimer's.
Especially when you combine it with curcumin.
Yeah, they're like a dynamic duo, right? Yeah. They're like a superpower team. There's no question that when you combine those 2 things, it's just amazing for your brain, amazing for your joints. But again, something to consider. Are you getting enough fish oil? Because the number one thing when it comes to fish oil that we see with people, either they're not taking it, or 2, when they are, they're taking 1 gram of fish oil. But when you actually look at the ingredients of the fish oil capsules they're taking, and if you're taking fish oil, go get your bottle, turn it around, look at the ingredients. It's 1 gram per capsule, usually are 500 milligrams. Actually look at how much DHA and EPA are in there. You'll be surprised. I'm willing to bet that most people that are listening, and if they look at it, they're not even getting 300 milligrams combined of DHA and EPA per capsule. There's not a lot in them. Unless you go, like we have a high DHA, which is a high DHA capsule. They get a ton of DHA per capsule. But that's the thing. So you want to make sure you're getting enough, because that's the 2 biggest problems that we see. They're either not taking it, or when they do, they're just not taking enough to get the therapeutic benefit that they need in order to see the results. So these would be considered high dosages for people, even though people can go a lot higher than this. But these studies looked at 2.5 grams, which a lot of studies just do 1 gram. And this other one was 5 grams, which is, again, that's typically not how they study it. So 2 studies on fish oil. Now, you had an interesting one on genetics that you wanted to talk about.
Yeah, when it was saying, and this is very interesting, that 98% change, like if you change, especially in the diet. So we all know what your genes are, right? You're made up of your DNA and the way you're built. And so people that come in, and, you studied a lot of genetics when you were in school in the 90s, and it's something that we studied very little in the 70s when I was in school. So the 90s was the genetic age, and still today it is, because, most pharmaceuticals are looking at genetics and able to change genetics and to override some genetics with medications, right? And they're looking at cancer that way and whatever. But what they showed in this study, that there is a 98% improvement in your genes. It's almost like overriding bad genes if you make lifestyle changes. So it's something we've been saying at the Martin Clinic for years. That is, listen, the Martians, we often tease ourselves because we're Martins, but, we come from another planet. We're Martians. But that's what my brother-in-law used to say about us, right? But you know us, right? Like we got a lot of bad genetics, right? In terms of diabetes, in terms of...
Yeah, a lot of cancer.
A lot of cancer in our family, right? And, listen, do I take that seriously? Of course I do. And so when people come in and say, oh, my mother had breast cancer, and here's a woman, very concerned about what her estrogen levels are. And, rightly so. Absolutely. Very important. But I always tell them, listen. And this study is confirming it, that lifestyle overrides, in 98% of the cases, bad genetics. So if you got diabetes in your family, it's written all over you. You're African American, and you got certain deficiencies, and you look at the First Nations here in Canada, diabetes is coming out both their ears. East Indian population, we used to deal with some colleagues that were Egyptian, and lots of diabetes. Half of the population are diabetic over there, right? So there's genetics involved. But you know what? The good news of this study is, if you change lifestyle, especially diet, like, of course, we love exercise. We call it the true vitamin E. We're big on especially resistant weight exercises. We just proven it to thousands of patients. But all I'm saying is, isn't it an interesting dynamic? Is if you look at lifestyle changes. This is what I tell my patients every day. This is what we talk about why are we so passionate?
Well, and it's actually exciting because you're not tied to your genetics in a lot of ways, right? Because it's a lot of guys have family history of, men in their family dying of a heart attack in their 40s or 50s. Mm-hmm. And they think that they're doomed for that. However, we now know that's not necessarily true. Now, they have a weakness in that area, so they would definitely want to make some big lifestyle changes. Earlier the better, right? Earlier the better. But it is nice to know, because again, our genetics, our family tree genetics we got everything, right? We got a lot of cancers, like you said. We got a lot of everything. So just based on genetics alone, it would not be good.
We're bad insurance risk.
No kidding. Just family history. It's like, you got time. You got time for family history. It's like, yes, cancer. What kind? Yes. What kind of cancer? Cancer. It's up our family tree. We got it all. No question. Yeah. But it's nice to know that dietary changes, especially, can have a major effect on that. So that's very encouraging for people to hear that, to know that they can have some control, and actually a lot more than they realize, over even their genetics, right? Even their genetics, they can have a lot of control over that. Now, let's just end this podcast off talking about actually some research that was done in our backyard here, in a sense. Here, we're up recording this up in Sudbury, Ontario. The university in town here looked at the population of raccoons. Did you see that?
Yeah, I tweeted about it today.
And how they are getting fatter and sicker and diabetic because they're eating our garbage. And we're eating our garbage as well, right? But it goes to show you that it's the food. It's so crazy to think about it. The raccoons are proving it's our food.
Yeah, because raccoons always ate garbage.
Always ate garbage. And now they're getting sick.
Years, if they could get into your garbage, they were in there.
Now they're getting sick. Well, you know what's funny? In the backyard earlier this summer, we were all sitting in the backyard, and this big, fat raccoon just found its way in our backyard because we left the door on the side. It just looked at us. We looked at it, and then it took off. And then, of course, I went into my garage because I had it open, and garbage everywhere. He got into our garbage, right? But it's amazing that this study was done, and it's actually caught some national attention, how raccoons are getting sick eating our garbage.
They're obese.
It is proof that the problem is our food. It's our food. What drives me crazy is this irritates me. The same advice for diabetes eating is given today. Everything we know about it, and the advice is giving people diabetes, But raccoons are getting sick eating our garbage, our leftovers. If there's ever an indictment on the North American diet, it's the fact that the raccoons are getting sick eating our food.
I think that's a book, isn't it? We should talk.
Yeah, it would be. We could come up with some kind of catchy title with it. But it was interesting because that study was done.
About it. I enjoyed that this morning.
Yeah, it was a local study.
Yeah.
It was local researchers that found that, and it's not surprising in any way at all. But anyways, raccoons are getting sick eating our food. So that just kind of neither here nor there, but it just kind of gives you a little bit of insight to how, if it's making raccoons sick, we know what it's doing to us. And so when cancer levels are rising, our cardiovascular disease are rising, our Alzheimer's disease is rising, and type 2 diabetes is rising, we know why. It's food. Yeah. It's food. And fixing your food can override your genetics, as studies have shown. Yeah. And again, awesome stuff. So,
and and just let me rant for 5 seconds, okay? You don't mind?
No, go ahead.
Because it bugs me that when we are talking about genetic, is that all the money that we raise, cardio, cancer, Alzheimer's, and diabetes, what are they doing? They're looking for a drug.
Yeah, it's all drug research money.
Right? It's drug research money. And the answer is in lifestyle food. That's where the answer is. That's not where the money's going, but that's where the answer is. And you know what, folks? You heard it. We've been saying it for years, and we're consistently telling you that you can't control everything in life. You just can't. But what you can control is what you put in your mouth every day, what you eat, and don't be like the raccoons they're just all they thinking of is garbage. If they knew what they were eating was making them sick, I don't know if they would change or not, but you can change. And so this is why we do the podcast, right?
So we want to thank you for listening to this episode today. If you have any questions, you can email us at info@martinclinic.com. You can also go to our website, and we have chat on there. You have a bunch of different ways to get a hold of us. You can also become a newsletter subscriber where we talk about a lot of these things in our newsletters. You could do that at martinclinic.com. We also have a private Facebook group where if you come to our website, you can request to join, and it's a great community. We have staff that kind of go in there, post some really interesting stuff, and we answer a lot of questions in there. So that's a great thing. Every Thursday morning, you do a Facebook Live. So that's a great way, again, to interact with you. If you have any questions, jump on there, ask them. You'll answer them. You may answer them upside down or sideways for a bit, but that's all right. Again, there's a lot of ways you can get a hold of us. But again, we want to thank you for listening, and have a great day.